Hi everyone, it's Dr. Odette Suter. I'm here with Holly Ganz from AnimalBiome, and we are streaming live from the AHVMA conference, which is the American Holistic Veterinary Conference. And we're having a lot of fun, as you can see, when nerds get together.
Hey everybody.
And I want to, tell you a funny story. When I've met Holly before, a while ago. But anyways, she came to Chicago at one point for a conference or a meeting, and I can't remember what that meeting was, like some nutrition biome thing. Anyways, we didn't really have time to catch up very much. I live in the Chicago area, so we ended up meeting at the airport and had some coffee. And just like nerds, all we talked about was just the biome and bacteria and viruses and everything, and dogs and cats, and so it's funny. We were both sitting there at the airport talking shit. Pardon my French, but you have to have fun. And on that note, I'm wearing my shirt that poop is going to save the world. So we want to chat with you a little bit about that, because we're both super excited and passionate about it. For me, obviously, seeing what's happening with the animals when we restore their biome. So Holly, tell us a little bit about what makes you so passionate about it and how you got into this for people who don't know you.
Yeah, hi everybody. So I'm really passionate about poop also. It turned out that Odette and I are poop soulmates.
Yes.
And the reason I am is because antibiotics and sort of chemicals that are we come in contact with as part of our modern lifestyles can harm the core gut bacteria that provide really important functions for us and our pets. And right now, the only way to get those back is through a fecal transplant. And this has been something they've done in Chinese medicine for over 1,000 years, but it's really something in human medicine they've only really started doing in the last 50.
Yeah, they're way behind. Plus, they have a lot of restrictions too, with only being allowed to do it for C. diff infections, and you have to be half dead and have had a few rounds of antibiotics before they will even allow it. So a lot of people are actually doing it at home themselves. So anyways,
but it's hard to find a good
you.
donor, right?
Yeah.
Like not everybody has access to somebody who's super healthy and doesn't take medications and all that.
Yeah. So how do you guys go about, with your fecal donors to kind of test them and get to approving them, giving them the stamp of approval?
I didn't expect to be doing this, but almost 5 years ago we started a stool bank for healthy stool from cats and dogs, and we actually are constantly recruiting. If anybody thinks they have a super healthy cat or dog, let us know. We'd love to find out and see if we can get you in our program. We basically pick up poop 6 days a week. We have 2 drivers who drive around in the Bay Area, and then we do have some people who actually are mailing us in poop as well. We test it, of course, extensively for parasites and pathogens, and then we also make sure that they are on a healthy diet, they don't have any behavioral issues or any known health conditions. I view running a stool bank very much as a labor of love. It's not easy. It's sadly, most pets that we test aren't as healthy as their owners think they are, and but that's really our mission is to try and help all the pets be really healthy.
Mm-hmm. Yeah, we need to. We're getting a lot of feedback here about our hats, so thanks for you guys commenting too. But yeah, it's really difficult. I used to have a donor dog who had extremely good poop, but ever since then I have not been able to find a dog that would even match the criteria, because even as puppies they already have issues, and I know of dogs that were naturally raised, and then we do the fecal testing, and their microbiome is just a total mess. So just because we have a naturally raised animal doesn't really mean that anymore, and so it's become much more difficult to find donors. So yeah, again, if you have a dog who has pretty much been healthy their entire life and no bigger issues, definitely no allergies or behavior things, not being overweight, please reach out to Holly and AnimalBiome and see if your dog would qualify. I think it would be a great service to other dogs. We really need you, basically. So what do you see as kind of the greatest benefits, from the people? Because you do a lot of consultations with people who do the testing and then do the treatment. So, kind of share a little bit maybe some success stories that you have, maybe some challenges too,
Yeah, I mean, I think one starting point is that, like, when I developed a way of delivering a fecal transplant in an oral capsule that contains freeze-dried material. It's a great, I think, in addition to like the fresh or in-clinic transfers, it's something that can be done at home. And when I developed it, I had a dog named Yuki. She is a herding dog, and she was like my daughter, and really demanding, wonderful, like strong personality, just striking. And but later in life, she'd always had what I considered a cast iron stomach, which was great. But then when she got to be, I'd say maybe 12, she started to have hemorrhagic gastroenteritis, which is like bloody diarrhea, and if it doesn't get treated, they can end up with vomiting, and it can be life-threatening. I had a long commute back then, and so she had diarrhea, but we still went to work because we didn't know how severe it was. And when I came home, she was, I had to take her to the emergency room, and they had to put her on fluids, and we had to learn to manage this condition that flared up literally every 5 weeks for something like maybe a year and a half, and we could only have her on one food. Like, we'd do some chicken and rice food, and like we could only give her one treat, and if she randomly ate something on the sidewalk, then we'd have another flare up of bloody diarrhea, and it was really scary. And I gave her our approach to FMT, and it solved her problem. So I realized then that there was something real with fecal transplants. And I mean, she ended up ultimately getting a pancreatic cancer, so it may have been an early warning sign, but she didn't have any more bloody diarrhea, which was so scary. And it turns out that that's probably related to certain kind of bacteria becoming overabundant in the large intestine. But our testing can also help identify other things besides, like, that was a Clostridial overgrowth. You can have E. coli flare up. That's really common in some breeds. Seems like boxers and French bulldogs might be more susceptible to that. Our test can help you find out if that's a problem for your dog or cat. And but one thing I didn't expect when I started all this was that the testing could help with maybe making the diet a bit more personalized. So some pets need a little more fiber than others, and it's really useful to understand the balance of these different groups of bacteria, which I know probably people don't like all the names of these different things, but they serve different functions, and it gives us some insights into how things are going and how balanced the community is. Mm-hmm. What do you think? How do you find it useful?
I find it useful because, especially when it's very off balance, then it gives me more information on how aggressive I need to be as far as treatment goes, and how often to retest and all of that. And I've also, one thing that I meant to ask you, I noticed that on some of these results we have a overgrowth of certain microbes that tend to have more anti-inflammatory properties. So yeah. I'm wondering if those are compensatory to the imbalance, so they're like, we have like a growing number of bacteria or microbes that try to keep the inflammation down.
Right. No, I think that's a really interesting idea, because the microbiome is really responsive, and it tries to adjust and help support the hosts. And so, yeah, there's certain groups like Blaudia, which we consider Blaudia to be like a beneficial group of bacteria, and it produces anti-inflammatory compounds. But in some we're finding that certain sick cats and dogs, that it is actually seems to be something that goes up, and maybe they're trying to compensate for these other things that are happening. Likewise, like, there's this ratio that we like to look at of two different kinds of bacteria, like that we call the firmicutes and the Bacteroidetes. And usually in humans, they found that, like, if you have too many of the F group compared to the B group, you're more likely to put on weight. And so we started looking at that with cats and dogs, and instead of finding that, what we're finding is that if they have high firmicutes, I think it's a sign of the body adjusting to some problem with digestion. And so some firmicutes are able to extract more calories from the same food. So it's kind of weird, like, our food says it has X number of calories in it, but that's like when they burn it. It's not when the microbiome consumes it. Mm-hmm. And so the amount of calories you get from food changes, and we all know, like, if you've ever done tried to lose weight with dieting, that it works for a few weeks, and then the weight loss slows down, and that's because the microbiome is actually shifted to adjust to this lower intake of calories.
Interesting. I always thought that it was just the metabolism that was shifting to that intake, but you're saying it's the microbiome that's shifting.
Well, it's probably both, but
both, yeah.
I just think about the microbiome side of things. But
yeah. Interesting. And yeah, for those of you guys who are listening in and don't really know what the microbiome is, we should probably talk about that briefly. It's just all the microbes that are in and around us, and we have so many of them, and there are 10 times more microbes than there are cells of the body. I mean, it depends on whether one just went to the bathroom or not. And from a genetic perspective, they outnumber the bodies, by a factor of 100 to 150. So I always ask people, well, who is running the show here, right? And in a seminar that I was listening to, it was a human one. There was Raphael, I think Kelman was his name. He's a medical doctor, and he talked a lot about the biome and the gut, and he had such a reverence for the microbes, but he would just basically say that we are just a heap of microbes dressed up in a suit. And that's really how it is, we're just really more the container for all these microbes that are everywhere, because humans, and I believe some apes, they even have microbes in the brain, although I don't think cats and dogs do, right?
Well, I don't know if we know.
Or maybe we don't know, I'm not sure. But
I mean, we used to think like the uterus was sterile, and now we know it's not. And we used to think urine is sterile, and it's not.
Or the brain, and with the blood-brain barrier that keeps everything out, we have to kind of wonder how these microbes even get in there, because that's like, super barrier, right?
But they can get in through the gums.
Yeah. Oh, okay.
Yeah, there's a connection of the oral microbiome to the heart and to the brain.
Yeah.
Yeah.
Talk a little bit more about the oral biome, because you guys are doing some research on that as well, right?
Yeah, actually we have a study going on with some veterinarians who specialize in dentistry, and we're looking at this chronic inflammatory condition that cats get called chronic gingiva stomatitis, FCGS for short, and it's really terrible condition that cats can get, and up until recently, the only thing that seemed to really work was to extract all their teeth, which is really sad. But they're so sick that's a better solution than
because it's painful. It's very painful.
Yeah, you can imagine like the lesions and So we're trying to study how the microbiome might differ in cats with just normal periodontal disease, normal healthy gums, and those that have these FCGS. Stomatitis is what I call it, but the specialists are like, well, it's not exactly.
Yeah. Well, they want to be exact.
Exact, yes. Especially if you're a dentist, I think.
Yeah.
So we're looking at what is healthy, and so there are bacteria in the mouth and some yeast that are normal, healthy members of the community. And even like there can be healthy plaques, but then some plaques we know are not healthy, and they promote the development of gum disease. And we do know some of the bad actors for gum disease. So we started doing some testing to try and be able to give extra tools for knowing when you should really worry about the plaque and maybe when it's fine.
Oh, okay. And so have they figured out? I mean, the study is still on the way, I'm assuming, or are there already some preliminary things that you can talk about, or is it all still kind of secret?
Well, so we haven't gotten a lot of, when you deal with specialists, it takes a while to get all the samples because they're really carefully screening for every patient, for the perfect patients. So we're still early days. We did get a grant for this, though, from the Foundation for Veterinary Dentistry, which we're very proud of.
That's amazing.
And so next year we should have the results, but what I can tell you that's exciting that they've found this year, and we're hoping to get additional data for this, is that there seems to be a fungal overgrowth that's associated with the stomatitis cases, and they're finding if they treat for that it resolves it. So there may be a solution coming very, very soon.
Oh, okay. That's so cool, because I mean there are a lot of dental things out there, like dental chews, dental toothpaste and everything, and I'm always a bit concerned, even with the more healthy ones, that have essential oils and things like that in it, because
it
attention. Always, though we get a lot of attention here. So because all of these antimicrobial things, they can also kill the good bugs, colloidal silver, essential oils. So I'm always a little bit more careful about, giving those, because I don't, if the microbiome of the mouth is healthy-ish, I don't want to create an imbalance that way.
Yeah, it's a complicated system. I mean, it's just as complicated as the gut. So, and there are cases like where the prophylactic use of antibiotics is necessary, where there have maybe abscesses, or you're more likely to believe that they would have pathogens that could go to the heart and cause heart disease. And so we can't completely eradicate antibiotic use.
No, I'm not saying
right?
that.
No, I'm not saying you were. But so we have to think about what tools should you use and when, and because they need the full gamut. And what I think with using other antimicrobials can be really helpful, but knowing is the biofilm diverse and having a good representation of the healthy groups is great. Could be a great tool. And one obvious thing is actually usually when they start to have gum disease, you can smell the breath, but we did just do a study where we found that I think that they have doggy breath even sometimes when things are normal, so it's harder to measure, I think, some of those chemicals that we're smelling. Our noses are better than the tools we have.
Yeah. Well, I mean, there's still so much unknown. And you shared yesterday about some other studies that are on the way and such, and I found that so fascinating. So
we're really excited about a study that actually is being conducted by the University of Illinois right now, and they're definitely recruiting patients. So if anyone's in Illinois, which I imagine some of your people are, since that's where you're based,
right?
We're looking for cats and dogs who have diabetes mellitus. So the idea is that a fecal transplant may be able to help them go into remission if they have this condition. So it's a placebo-controlled study. It's double-blinded, so we won't know, and you won't know if your cat or dog is getting the placebo or the real thing. But it's an interesting thing. The placebos are really important so that we can tell the difference between just a naturally occurring remission, like they might go into remission just on their own, and we need to know what that rate is. Also, I think being cared for is something that we respond to, and it turns out the placebo effect happens in cats and dogs too. And so we want to make sure that the FMT is something above the experience of getting care in terms of the effect on the condition. That's the big one we're excited about. We also have a study going on in Finland where they're looking at basically following a course of Tylosin with 30 days.
Which is an antibacterial that they use a lot for chronic diarrhea.
Yeah, so these are dogs that have chronic diarrhea that responds to Tylosin. But then they relapse almost 90% of them within 30 days and 100% within 90 days. And so the idea is to see if they can follow a course of Tylosin with 30 days of the FMT capsules and get them out of that medical merry-go-round. And so that's been ongoing. It was a bit delayed because the hospital had to close for a while in 2020 with COVID, so probably won't have the results for that for another year either.
Oh, okay. But gauging by your smile, it looks like it might be promising.
No, it's
already,
also blinded, so I don't know.
So you don't know anything, so it's more like the excitement of wanting to know, like waiting for the Christmas presents to open up, right? Yeah.
And but with the diabetes study, they just launched it, and one of the cats seems to have responded really quickly, and maybe it's in the placebo group, but it would be hard to understand why they would go into remission so fast.
Yeah, I mean, cats can be a bit more likely to go into remission than dogs for diabetes, but it would still take a little bit of time, and you said it was just a few days or something, right?
Yeah,
so that's amazing. So if you have a cat or a dog out there who is diabetic, reach out to the University of Illinois. Who is the lead person that they would contact? Do you know them? Remember the name?
Contact the vet school. They are, I think, trying to advertise it in their social media channels. Arnon Gall is the professor in charge of the study, but he has others doing the recruiting. I can look up their names and tag it in the post afterwards.
Okay. Yeah. All right. Sounds good. good. So as you can see, there's a lot of excitement going on, and I want to just touch a little bit on IBD, because that is such a... I feel like people, when they get the diagnosis IBD, which is inflammatory bowel disease, it's almost like they get kind of stuck in like this thing of, oh, this is never going to heal, this is never going to get better, my dog is always going to have it, and I gotta do some special diets and all of that. So I wanted to kind of address that a little bit, because there are a lot of people that have animals that have issues with IBD, and I wanted to just address that, because from my perspective it just means there's inflammation, because that's what it says. It's inflammatory bowel disease, so it's just inflammation, but it never says why. So maybe we can dive in a little bit into the microbiome, and also maybe what you've seen as far as after treatments with fecal transplants, and maybe also a little bit on testing if there's anything that pops up. And
yeah, happy to. So I don't know how many of you guys who are watching have a dog or cat with IBD, but let us know if you do and if you have any questions. So yeah, the way things started for me was that I was trying to understand what's the healthy microbiome in pet cats and pet dogs, and then I had all these people who told me their cat had chronic diarrhea and had been diagnosed with IBD, and so I started to ask people with their pets with IBD to send in samples so that we could try and understand what's happening there. And I'm not a veterinarian, I'm a microbiologist, but so they were like, what do I do? Because I was like, wow, their microbiomes looked really out of whack, and they were like, how do I fix this? And that's where I was like, as far as I know, I think fecal transplant seems like one of the only things. So they had all done steroids and prescription diets and what we now sort of call the medical merry-go-round, and they were still living with it. And I also learned the people they get so distressed that sometimes they send their cats to the shelter because they don't know how to deal with it, and or their dogs, and so it's a really heartbreaking condition, and I think it has multiple causes, right? It's not really just one thing. And fecal transplants do seem to really help with some of the symptoms, and you really want to get that inflammation under control, because if it goes on for a long time, it's really tightly linked with the development of GI lymphoma, especially in cats, but I think also dogs. And but it's tricky. I mean, you're the expert, but that's
Well, what I often find is that there's a merry-go-round with traditional medicine, where they try to do anti-inflammatory things and changing diets to hydrolyzed proteins and things like that. But I find it super important to look at the microbiome and see what's going on there, and then also looking at are there food sensitivities present that perpetuate the leaky gut issue, and then obviously then perpetuate the issue with the microbiome as well. So I often will do both, check the microbiome and do a food sensitivity test, just to see what foods I have to remove, at least for now, to allow the gut to heal, because if we're trying to do fecal transplants and restore the gut while they're still getting foods that are super irritating to the gut, it's not going to work. So it's like trying to extinguish the fire while throwing oil on it. So but I find that the majority of them, they get so much better, and it may still remain a bit of a weaker link, but at least in my practice I also work on other things, like reducing chemicals in the environment as much as possible, obviously changing the diet to something that's more species appropriate and has more it doesn't create more inflammation, because we know that with high carbohydrate diets the inflammatory markers go up. So we want to keep that down and feed fresh foods and what they would eat in the wild, basically, because that's what the body is made to do. Well, I mean, the body is not made to be eating all this processed stuff that is heated and basically killed, and then they put fats on it, they spray it on it that get rancid, and it's just a mess. It creates a mess in the body, and that can also then reflect in the gut itself, obviously, and keep the inflammation going. So
I think
there are
we
a
have
lot
a
of other
question.
things. Oh, we have a question. If my Lori, hi Lori. If my dog cannot eat raw, I feed lightly cooked. Oh man, it's on the white.
Does that mean they have IBD?
Sorry, doesn't mean they have IBD. Okay.
So,
you want to take that one?
I think that one thing I also learned from people and have now found with my own pets is that a raw diet can be a really beneficial way to help resolve IBD, but not all pets can transition to it.
Right.
And also I think particularly as they get older, they may have trouble digesting it. They might need their food to be cooked. It just, the system can't keep up as you get old. And so I don't know what it means in terms of a diagnosis for IBD, but it just means that probably maybe I would look more towards cooked diets. Maybe as they start to have kidney disease, also maybe the high protein, which we really like for having a lean, young, healthy dog, needs to be tampered back a little bit.
Yeah, I mean, it has to be high quality protein for sure.
Yeah.
But obviously, if an animal cannot tolerate the diet that they should be eating in the wild, I would always start with checking the microbiome to see what's going on, because oftentimes when they have a microbial imbalance in the gut, they don't tolerate changes of diet either. Like, I have some patients where every time they change the diet to something else, it just, it squirts out the rear end again. So why is that? Because the microbiome is so sensitive to food change, and it changes with food, so that could be part of it. Certainly something I would look at. And then in older animals, or in general with animals that have GI issues, I love adding some enzymes because that can help with the breaking down of foods. And personally, I used to sell a lot of probiotics, but I don't anymore, because probiotics, let's back off. The microbiome is made of 300 to 1,000 species?
At least.
Or at least, right? Yeah. Probiotics have maybe 10 if you're lucky, and they may not even be the right ones that the body needs. And I know you have probably more to say about that. But if you already have an imbalance in the microbiome, and then you're feeding the wrong kind of the microbes, like the probiotics, that may just create more of an imbalance and make things worse. So I definitely get them off of any probiotics and fermented foods, because fermented foods can do that as well. Just to kind of give it a break and then do the testing and then, fix the microbiome that way. And I keep forgetting, how long would they be off of the probiotics? I usually say about a week.
Yeah, a week should be fine. And I think we did 2 weeks for the after the FMT, just to be sort of, part of it is we just want to see what kind of lasting effect there is for that. Right. But for even several days is probably enough for the probiotics to pass through the system.
Yeah.
But yeah, I think probiotics are like vitamins. Like if the diet is balanced, like we don't need to take vitamins unless there's something wrong with us, right? And and I just want to put out there that like some older cats and dogs do need like B vitamin supplementation. I think that's really beneficial. But if they're young and healthy, they shouldn't need that either. It should be produced in the gut. Also, I think some of these food sensitivities can be sort of microbiome mediated, but you need to figure out how to calm things down first and get them stable. And so it could be that later on you're going to add back in fermented foods, or you'll add back in some probiotics if they're needed to like support health. But if you want to try and give the native microbes in a fecal transplant the best chance to survive and colonize, you want to get them off.
Yeah, and we were kind of talking a little bit yesterday about, I have one patient who used to have a lot of diarrhea, and the microbiome looked pretty awful. And then I think we did the capsules, a round of it for 30 days. And then we rechecked the microbiome. The microbiome was barely changed, but the dog doesn't have any symptoms anymore. So the diarrhea resolved, and the dog is happy and everything. So we talked a little bit about why that is, because we test these few microbes, but we don't really know what else is in the poop, right? That could possibly help, when we do the transplant. So
no, but the testing we do is discovery based, so we're testing for all known bacteria. So unlike a PCR panel.
Right. But I mean, there's the viruses and the fungi and all
right.
of that.
But the bacteria make up like 80% of the microbial community in fecal material, so it's a really good place to start. But it's true, if there's like one fungal group that's causing a big problem, you won't pick it up with the bacterial test. We do have marker genes for fungi too.
Oh, okay.
We just haven't found them yet to be useful, but that's something that we're working on. I mean, because we can do it, it would add some cost, and we're trying to make it as affordable for people as possible.
Right. Yeah, because most people have already spent a lot of money when it comes to that.
Yeah, by the time they come to us, they've been down the road.
Yeah. And Elvira mentions there's also the hormones to check. Yes, definitely. I have found that sometimes when they, especially cortisol levels, are not in the normal range, that they also, which also then has an effect on the thyroid hormones, that they have a harder time maintaining a better microbiome. So definitely. All right. Any last words of wisdom that you have for people?
Just keep up all the good work taking care of your pets. It's really nice that you guys are watching us today.
Yeah, and share with people, because a lot of animals have issues with GI, and they can benefit from this information. So feel free to share. You know, you guys are the village that makes everything run. And hey, if you need a hat for Halloween, that would be a good one. Anyways, it was so good to see you guys all. Thanks for tuning in. We love you. And
should we show them the giant one?
Oh yeah, maybe. We have a giant one too. I think you want to see that one. Here.
We're poop crazy.
Yeah, so we're poop crazy. So we have a floaty here.
You can get one of these for your pool.
Yeah, it certainly would bring a lot of fun to your pool party. All right, you guys, we love you, and we'll see you soon. Bye.